So we will start with the first task. Doctor, your reading time starts now.
Okay.
Tell me when to change the slide.
Many slides?
Yeah.
How many slides?
3-4 slides are there. Just
Okay.
tell me. Yeah.
The next slide. Okay, next one.
Your time is up, doctor.
Okay.
You
Hello.
want to take more time to read?
Just make that last slide. I did not
Yeah.
see.
This is the last slide.
Yeah.
But time is counted from your performance. Okay.
Okay. Yes. Hello, I am Dr. Shanti, one of the doctor in the gynae clinic today. May I confirm your name and age, please?
Doctor, I'm Anita Sharma. My age is 42, doctor.
Okay, may I call you Anita?
Yeah, that's fine, doctor. That's fine.
Yeah. Anita, I can see from your GP letter that you have some tummy pain, and also you have been done some blood test by your GP, and also you have done scan. And today you are here to discuss both the report. Am I right?
Yes, doctor. Actually, maybe this particular pain which is there, it's a sort of on and off pain. And I am uncomfortable lower down in the tummy, doctor. And there is a little bloating also. So I went to GP, and GP suggested me certain tests, the scan, the blood test. And then GP referred me with a letter. I'm really worried, doctor, whether I have got a cancer or something like that, doctor. Because GP didn't explain me anything. So I just want to know what is the situation.
Okay, so I can understand your distress. Surely I will address all your concerns. How long you are having this problem?
Yeah, doctor, around 6 months now, 6 to 8 months now. I have got pain in lower tummy, and it's on and off, doctor. It's uncomfortable, especially when I walk around, especially climb the staircase that time.
And do you feel any swelling in your tummy?
Some fullness I noticed, doctor.
Okay. Okay, so do you have any bleeding or discharge from down below?
No, doctor, I have my regular periods. Otherwise, there is no issue, doctor.
And have you noticed any recent changes in your weight or in your appetite?
No, I think appetite is little reduced, but not significantly, doctor.
And what about your water and bowel opening?
Yeah, that is quite normal, doctor.
And your periods are regular?
Yes, my periods are very regular, doctor.
And your last period?
It was 8 days back, doctor.
Mhm. And any contraception are you using?
My husband is using, doctor.
Mhm. And do you have any bleeding in between the periods?
No, 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 doctor. Nothing like that.
And any contraception?
I just told you
Oh, sorry, sorry. Yeah,
my
yeah,
husband
sorry.
is using, doctor.
Yeah, yeah. And what about your smear?
Yeah, my smear is normal. I am doing my tests regularly, and all my smears were normal, doctor.
And I can see that you have two children before. And what is the mode of delivery?
Yeah, actually, I had both deliveries with midwife, and both were normal deliveries. My both are teenagers now. One is 15 years, another is 12 years. John and Matthew, doctor. Both of
Mm-hmm.
them.
Mm-hmm. And any allergic to any medications?
No, no, doctor. No allergies.
Any surgeries before?
No, doctor.
Hmm. And any family history of significant? I can see from your notes that your mother was having some breast cancer.
Yeah, yes,
Yeah,
doctor. That is why I'm worried whether I have got some cancer or something like that. Can you tell me what is there in my reports, doctor?
yeah, sure. Surely I will tell. And in a moment. And can you tell me your body mass index?
Yeah, it is 26, doctor.
And regarding your social habits, do you smoke?
No, doctor. No.
Any other recreational drug or alcohol?
Occasionally alcohol on weekends, doctor.
Mhm. Okay, so thank you so much, Amita, for giving me this information. And I would like to examine in the presence of a sapper and just to see your general conditions, any anemia is there, or your tummy, any fullness, any swelling, any mass is there, what type of mass, any tenderness. I like to see, and also from down below, any bleeding or discharge. And coming to your concerns, and can I have the next slide, the report slide?
Yeah, yeah.
So I have confirmed your name, NHS number in your scan report, and also some blood report. So Anita, I can see that you are alone here, and I am worried. So I have to give you some very important information regarding the report. So do you mind to call someone to be with you?
My husband is at work, doctor, but you can go ahead. What does the report you mean to say? Do I have a cancer, doctor?
Actually, your womb is okay, and then left side of ovary is also is fine. And I can see that right ovary there is there is a fluid like sac is there. That is we call it cyst. So it is a little quite large, 7 to 6 centimeter. And also the most important thing is that it does not look like simple. So in the this fluid like sac inside that there is some solid component as well, and some projections of the I can draw and see here. So inside the this is the your ovary, and then fluid like cyst, and inside there is some solid component, and then some projection like. So these features are, and also there is one doppler in essence we see the blood flow to this cyst. So there is it is also increased, and some amount of fluid in the pelvis as well. So, and there are other report as well, specific protein test has been done, and that is also more than the normal level. So,
So
and
you mean to say, doctor, means these findings which you are telling, it does it suggest that it is a cancer, doctor?
actually, yes, by this ultrasound features and this protein report, most probably it may be cancer. So, till
Oh
now, we
my
cannot
God,
confirm.
doctor. Yeah. So, doctor, then do I have to undergo surgery, doctor, then?
Yes, I can understand, Anita, your condition. Do you want to take some more time, or you want to please with someone?
Yeah, doctor, actually, I'm really stressed. I don't know what to do.
Yes, Anita, I can understand the term of the cancer itself is very scary sound, and in your
Yeah.
situation, I can understand. But if you want to have another consultation, it's okay for me, or I can continue today.
You continue, doctor. Give me some idea now. What will be the next step and all?
Yes, yes, so Anita, so don't worry, we are here as a team of doctors to help and support you. and I will also connect you to the some counselor and support group. And your treatment will be with the team of doctors, specialist doctors. We call it a multidisciplinary team of doctors, and we need to do further investigations as well. Okay, so this protein increase in protein can be increased not only in the cancer condition, it can be increased in other conditions as well, benign conditions as well. So we need to repeat that test as well, and we need to do further special scan like a CT, MRI to see whether what kind of this cyst is there. And as I told, your this care will be the multidisciplinary team of doctors, my consultant and gynecologist, and the cancer doctor, specialist nurse, and also the emergency doctor will be in your care. And so I will refer you to the special oncology center, and they will see your case. And mostly with your consent, we'll be taking your consent, and mostly we have to go for the surgery after the confirming the, further investigations. So in this surgery, we have to see whether we can remove the affected ovary and how far it is spread. So whether other ovary we can save, depending upon that, we have to decide. But the right ovary, whichever the affected, we have to remove. Okay, and so we call it like a staging laparotomy. In that case, we have to remove your ovary, and what are the suspicious area, we have to take the biopsy as well, and some fluid in the tummy, that also we have to take for investigation for cells, different, like whether in
So
abnormal cells. Yes,
it is going to be a very major surgery, doctor, you mean to say?
yes, it will be a major surgery. I'm sorry to tell, but it will be a major surgery. I'm so sorry to be the bearer of this news, Anita.
Yeah. How long I'll have to stay in the hospital, doctor?
Actually, this surgery will take around 2 to 3 hours, and this is a major surgery, and it will be in expert hand. And any other surgeries, like you have to take 2 to 3 days for the recovery, and after which you have
Time
to
is
see. Yes.
uh, it was a simple station. Only thing is that there were 4 slides, and all slides were very important because
Yeah.
you have to have what is given to you. So make a habit of having little long stations and reading fast. In the sense, you need to, first thing, if there are 3 or 4 pages, assume that you are entering into the station, and
Hmm.
outside there will be 4 or 5 pages. So you should
Hmm.
be able to read like this, you know,
Hmm.
scan the paper, something like that. Okay, I
No
have
need to
given this.
write down, because I was writing down, so it will
Yeah,
be
yeah,
like. Hmm.
correct. See,
You need
if
to
it is
write
a,
down or what?
yeah, there are 2 ways. One, writing is always good. Okay, but
Hmm.
you should time that, whether do you have that much of time. Say, for example, multiple pages will be there in surgical cases,
Hmm.
especially post-surgical. You have got some cases operated, and then your chart is given and all those things. Then labor case, you are likely to have such particular finding. While
Hmm.
rest of the cases like maternal medicine and all, they will be 1 or 2 pages only, not more than that. Teaching, a single page will be there. At the most, you will be given LCG with that and all. But these particular stations where you have 3 or 4, you need to decide how much time you will spend in writing. Okay, so that writing work, you should, once you finish, no, then at that particular time you should start writing. That is what is my suggestion. Okay, so first thing is a scanning of all the pages which are given to you. That is the most, because you understand what exactly you are dealing with. What is here, what is the age of the patient, what is her complaint, and
Yes.
what I am dealing with, whether I am dealing with uterus, ovary, or what. Because there is a complex ovarian cyst, solid component, so most likely I am dealing with some malignancy and all.
Hmm.
Now you have got that particular idea about the station, that will tell about your applied clinical knowledge which you are going to present. But at the same time, assume that you may have to tackle with some anxiety of the role player and all. These two are totally different things. You
Hmm.
have prepared yourself with the clinical knowledge and this particular, and once you enter the station, the flow goes in a different way because of the what you can say, the a role player is taking in a emotional and different way. So we should be able to balance both the things. Okay, so never assume that it will be straightforward station like that. Okay, that is why those 2 minutes are going to be very, very important, in which you need to be, once you enter, you need to be firm and assess with the initial flow of questions what is the attitude and in what way your station is going. Are you getting what I mean to say?
Yeah,
Okay.
yeah, yeah.
Now, yeah. Now here, definitely, in this particular patient, where there is a family history of cancer, and your role player is saying, "Doctor, is it cancer? Is it a cancer?" Assume that you need to calm the role player, okay,
Mm,
and relieve
mm,
that particular anxiety. Second thing
mm,
is that in such situation, yes, the findings are not absolutely normal. There is a possibility of cancer, but at this moment I cannot say anything. Most of the cases we will be confirming after the surgery only, and this is what is the routine procedure. Okay,
mm,
here
mm.
because basically we will not, in CA ORI, we are not going to do any pre-operative biopsy or something. It is, she will be posted for surgical, and
Yes.
there then you correlate that, looking into your blood test and looking into your sonography report, and you have very well, yes, I'll show you, explain you with the help of diagram. Okay, then you
Mm,
pointed out that solid area,
mm,
that particular, the size of the, what it is said as a complex, it is
mm,
not only filled with the water, but
mm,
it has got some different texture also. So
mm,
you go in that particular way. Yes, these are the things which are not normal, which are making us to think about cancer, and the treatment will be surgical, then multidisciplinary. You have explained everything. One thing where you said that I'll examine you in presence of chaperone and the general examination. There you could have saved time. Your here sentence is, yes, I would like to do the general examination and examination down below. If you are comfortable, I'll do the examination down below. Is that okay? Is more than,
okay.
you mentioned about the anemia and
Handling.
all. These
Yeah,
are
not that. Mm,
medical charges. Okay,
okay.
it will be like the blood strength and all. It is a general examination. But why to present that particular information and lose the score?
Yes.
Because
Mm,
we are talking about medical jargons. Leave it.
yes.
That is a safety point.
Mm,
Examination in presence of chaperone, that is the thing which is required. Okay.
mm,
uh, no doubt, when you are talking about the investigation, you need to have a justification. Okay,
yes.
so
Yes.
then try to avoid the medical jargon. Overall, your performance was quite good. I'll say it is a borderline towards pass. Pass will be if you would have completed the complete station. Okay, but the empathy was good. Okay, so let
Mm,
us go ahead with the this particular marking sort of thing.
okay.
So what is expected in the information gathering is just info. So it has to be a focus, history taking, bloating, pain, cycles, weight loss, then family history of cancer. Here, one more thing about the breast, and there was a history of breast cancer. So
Okay.
genetic screening, that particular thing. And luckily, this lady had both son. But if she would have had a daughter, then you should have also asked whether any cancer screening
Yeah,
for the breast
definitely.
or anything has been suggested to you previously or not. Okay,
Mm,
so
mm,
that question is also very, very important.
mm,
Menstrual history, red flag symptoms you have asked, explain CA125 raised but not diagnostic. You have told that it is raised in multiple conditions and all. Okay,
mm.
and if either of the thing would have been there, definitely you would have more towards benign nature. Like there is only cyst, but this CA125. But when the things are happening together,
Yes.
definitely we have to think about the malignancy. But only thing is that you never confirm the things
Mm,
100%. Okay. Second thing is, advice is urgent referral to gynae oncology. Here it is that particular thing. You have definitely mentioned about the MDT, but put a time limit. Okay, we'll be working up. We'll do the workup as early as possible, and we need
mm,
to get the things done within 2 weeks
mm,
from here onwards. Okay, plans appropriate. That also you suggested that we'll need to get additional investigation done. Addresses familial risk and consider genetic referral. I just explained you. Okay, if appropriate.
mm,
Okay.
mm,
Then communication and empathy. Explains scan shows a complex mass, not definitely cancer. explains next steps calmly, referral to oncology immediately, that is done, recognizes risk of malignancy, acknowledges the patient's anxiety, reassures but does not give a false hope. Okay, you need to, the treatment is available, the most of the things can be tackled by surgical methods. Very few will require some additional treatment. We will have the best idea once the surgery is done. All these will come into the reassurance, but not the false hope. Allows patient to ask questions and uses lay terms, avoids jargon. Okay. Then applied clinical knowledge, suggest empirical discussion, discusses need for possible surgery, laparotomy versus laparoscopy. Here, definitely laparotomy is going to be the better option. Then mentions fertility or HRT implications sensitively. Okay. Outlines management plan. And what exactly some instructions are generally given. Do not expect a definitely here it is your structured approach that has been assessed. Okay, not a definitive diagnosis. Okay, so there are certain stations where it is not, we are not looking for whether it is fibroma or what exactly this particular thing is, but how you are approaching to the station. Okay, look for a structured approach and safe plan. Credit for involving the patient in decision making and checking understanding. Here actually we have not reached to that shared decision making. Okay, so that when I say, in most of the time you must have heard that closing the station. So when we discuss about that means this particular thing you have explained and come to a shared decision making. Okay, that becomes a good closure of that particular station. Okay, the candidate should avoid falsely reassuring or alarm. Okay, so we need to have a non-judgmental attitude over here, but definitely more towards malignancy, the discussion will go. Okay, the CA 125 results should be interpreted in the context. Okay, so that is what about this particular task. So shall we go ahead with the next task?
Yeah,
So
yeah,
this is
yeah.
clear. Okay,
Yes, yes.
and remember on this particular line, one task will definitely come, little bit here and there. But on this particular line, you may have some with momental kicking, with ascites and all. The picture will change. In that particular, just main format will be like what we have discussed. Okay, depending upon that particular finding which are given to you, your flow will go in that particular direction. So we'll start with the next task. Your time starts now. You have one more slide.
Okay. Other one.
Time is up, doctor.
Okay, okay. Hello, I am Dr. Shanti, one of the doctor in the gynae clinic today. May I confirm your name as your age, please?
Doctor, I'm Radha Devi and my age is 58, doctor.
Okay. Can I call you Radha?
Yeah, yes, doctor.
Yeah, rather I can see that you have some heaviness and pain in your tummy, and you have done some scan and also some blood investigations by your GP, and you are here to discuss. Am I right?
Yes, doctor. Yes, actually, yeah, I think almost a year now I'm having some pain. I thought, it may be some age related, maybe some acidity or something like that. There was bloating also, but it was persistent. So I visited a GP, and GP carried out certain tests. So, and then GP told me that I need to meet a consultant. So can you tell
Okay.
me, doctor, about
Yeah,
this?
yeah. Actually, I apologize for the absence of my consultant, and today I'll be taking your consultation with your permission. Is that be fine?
Yes, doctor. Yes, that's okay.
Yeah, then at the end, I will also give appointment with my consultant and I will give you patient information booklet as well. Okay. So can you tell me
Yes.
details regarding your problem as you are telling that you are having fullness since 1 year, and can you tell me more detail regarding that?
Yes, doctor, it's a sort of heaviness, and I always used to feel bloating, and my food intake is also reduced in last 2 3 months. Though I am still maintaining the weight, but I feel that I do not have that much of appetite. And,
Mhm,
that is why GP carried out certain tests.
mhm.
So that's the thing,
And
doctor.
and do you feel tired, giddiness, or fainting like that?
No, doctor, no, no.
Okay. And what about your water works and bowel works?
Yeah, it is good, normal, doctor. Nothing, no issue about that.
And what about your periods?
Doctor, it stopped around 6 7 years, doctor.
And any did you have any intermenstrual bleeding?
No, doctor, no.
Mm. And the last period, okay, you told that it is the last. When is the last period?
Around 6 years back, doctor.
6 years. 6 years. Okay. And what about your smear?
Yeah, actually, my smears were always normal. There was no problem with my smears up till now.
And some of my questions will be little inclusive. And do you have any pain during the sex and also after the sex?
No, doctor, I did not notice that.
Mhm, mhm. And also, do you have any children before?
Yes, doctor, I have got two kids, but they are grown up now.
Mhm, mhm. And any allergic to any medications?
Doctor, no, no.
Any medical history?
No, doctor, no.
Mhm. And any family history of any cancers or breast cancer or any
Uh,
ovary cancers.
yeah, my sister she was elder to me, and it was cancer ovary which she had, and it
Mm-hmm.
was really miserable. She's no more now, but she had required some chemotherapy also. So
Mm-hmm. Sorry
really,
to hear that.
I'm worried, doctor, whether I also have some cancer or something like that, because GB didn't tell me anything about my reports.
Yeah, I can understand your anxiety. And whether any genetic test was done for your sister.
No, doctor, no.
And I can see that your normal, I mean, your height to weight test is normal. And what about your personal habits like smoking and taking alcohol?
No, doctor, no. I don't smoke or I don't take alcohol also.
Okay. So thank you so much for giving me this information, and I like to examine the presence of this happen just to look for general condition and your tummy and also down below. And coming to the your concerns, and I have confirmed your name, your NHS number in the scan report as well as the investigation report. Okay, so I can see Mrs. Radha that you are alone here. And would you mind to call someone to be with you as I have to give you a lot of information?
You can go ahead, doctor. But
Uh,
really, you mean to say I have a cancer or something like that from these reports?
yeah, I am I am saying the report. So, in the scan report, I can see that you have your womb that is looks normal, and also there is a sort of fluid filled sac, and which is around uh, yeah. So, which is also around 5 6 into 5 centimeter on the left side, And usually this is not a simple. It is like complex containing of. If I can draw this cyst, so there is like complex means it is like inside there is some secretion, and also the blood flow to this area is increased, and there is also some fluid inside the tummy, and that means it is not a normal simple cyst. Okay. And one
Yes.
more thing is that we have done some blood test that is a special protein, so that is also is increased. So in this uh, with your age and also your menopausal status and your this protein report and this ultrasound findings, when we see this risk factor, it is towards higher side of towards cancer. I'm so sorry to tell that.
Oh, doctor. So will I need surgery, doctor, for this?
Actually, Mrs. Radha, further your care will be under a multidisciplinary team of doctors. At present, we'll refer you to the before referring to the MDT and multidisciplinary team of doctors, which where like my consultant, gynecologist, oncology, I mean is cancer doctor, and also specialist nurse will be there, and imaging doctor will be there. Before that, we have to do the special scan that is called the CT scan. After then, we'll be giving more clear picture of this cyst, and we'll be referring within 2 weeks. Urgently, we'll be referring to the specialist unit, that oncology unit, and again they will decide the further management of your conditions. And mostly, we have to go for the surgical management, which will be the best options for you. And of course, this will be done with your permission. Are you with me?
Yes, doctor, I'm getting what I, but I'm really afraid of surgery, doctor. Is there
I
any
can
other option?
I can understand your concerns. Other options are like, there are also some medication injection. We call it chemotherapy, which is given to kill the cancer cells. And other one is, radiotherapy, that is, type of the X-ray, high energy X-ray. So which is given to the particular area so that it will kill also the cancer cells. But in your case, we don't know how much the spread of this cancer. So the that will be the less appropriate than the surgical management. So in that surgery, we have to see after the surgery. Till now, we have not confirmed whether it is cancer or no. So surgery would be the better option. So after the surgery, we have to take this tissue and examine and to confirm the diagnosis. Are you with me?
Yes, doctor. Yes.
Yeah, and the
So
other thing is that you had also a history of your sister. So I will also refer to the genetic counselor, and they will be doing the specific protein for you, and to see whether you are also risk factor for this cancer or not. Okay.
yes, doctor.
Uh,
Okay. So you mean to say I'll have to undergo certain tests, some
yes, yes,
investigations, and
yes,
I need to
yes,
meet
yeah, yeah,
some specialist also because
yes,
my
yes.
sister also had the
Yeah.
thing.
So I will give you patient information leaflet, and I will also give appointment with my consultant as soon as possible. And we will refer you urgently to the specialist clinic like oncology clinic after doing the special scan CT scan. Any questions so
Yeah,
far?
doctor, but you mentioned about the surgery, but you mean to say you will remove my ovaries or you will remove my womb also? What exactly you'll be doing in the surgery, doctor?
Actually, yeah, actually, the both the ovaries, both the tubes and ovaries will be removing, and also as you have the other risk factors, so the MTP will decide whether to remove your womb or no, based on the risk factors. Otherwise, only if ovary, then you have to remove the both ovary and tube. Okay.
Okay, you mean to say you'll be removing the womb also,
Yes,
and
yes.
both the ovaries
Both
you will remove?
ovaries, both the ovaries and tubes. Because if we keep, there is a high chances of a recurrence and also chances of cancer again.
My God.
Already, yeah. Already, your periods has stopped and your menopause at this stage. It better option will be removed, but of course we will take your consent as first also.
Okay, okay. So after the
I,
surgery, for how many days I need to be in the hospital, doctor?
yeah, it depends on how much you are improving. Like within 1 to 2 days, however you are able to improve yourself. You are once you are comfortable, you are able to take a food and solid, and you
Time
are
is
able to
up.
first.
Time
Yes,
time is up.
yes, yes.
Yeah, yeah. This particular station means you have performed well. You have covered most of the aspects, including the explanation of the report was also quite good. Okay, and you have touched the surgical aspect also. And second thing is that definitely what happens when you are performing these major stations, you sometimes do not know what is exactly
Yeah.
expected by the role player. So
Hmm.
that last question, doctor, will you remove womb also? Will you? So some kind of
Yeah.
surgical applied clinical knowledge is also expected. You just get that particular hint, okay, and it is you maintain a proper flow,
Hmm.
so everything was going smoothly. But
Hmm.
whatever was expected, some surgical aspect, what kind of surgery you are going to perform, that was not mentioned. So role player ask you, that is
Definitely.
you remember those particular points,
Yeah.
never neglect the hints which are given by the role player. That is how you come to know, okay, and there are marks when they ask, no,
Hmm.
there are
Hmm.
specific marks
Hmm.
score for it. If you miss this, or if you say that okay, I will come to that, and if you do not come because the your station is lengthy and all, then unnecessarily will lose. That is the thing. But overall this particular station was good actually. Here if you compare both the stations,
Yes.
they had a very similar presentation,
Yeah,
but
similar.
similar presentation, but there is a difference which actually I forgot to tell in the first station. That was a premenopausal cyst. Here
Hmm.
it was a postmenopausal
First,
cyst. So
yes.
postmenopausal cyst, CA125, and
RMS.
explanation about the RMI is going to be very
Yes.
important. And
Yes.
there actually along with CA125, we need to carry
Tumor
out
marker.
certain other
Yeah.
tumor markers also. Okay,
Yeah.
and for that I specifically kept both stations
I
together.
I forgot. I forgot tumor markers actually.
So, and actually I forgot that in explanation, but I now
Yeah.
you'll remember, because
Yeah. Yeah.
the
Yeah.
station was planned for that only. Otherwise presentation was same, management was same in
Yeah.
both cases. Okay, the second thing is that blood group, here BMI in the second station, and
Uh, blood group and
that
reservation.
yeah,
Correct. Yes.
that way mental health also you didn't ask, but those questions are generally you are asking those questions in all stations, I remember.
Yeah.
Okay, so do not miss those things also.
Hmm.
Okay, uh,
Yes.
so rest of the things are the same what we have discussed, so we'll go through the slides only. Okay, but you understood the difference between the two stations, what was expected more
Yeah.
or
Yeah.
less.
Yeah.
So information gathering. Clarify presenting symptom, onset, duration, nature, progression of abdominal heaviness, menstrual history, postmenopausal status is confirmed that there is an amenorrhea more than 12 months. There are associated symptoms like abdominal pain, bloating, early satiety, weight loss, weight gain, urinary bowel symptoms, frequency, constipation, urgency, vaginal bleeding or discharge, etc. Then other systemic inquiry about fatigue, weight loss, appetite changes, past medical and surgical, any pelvic surgery, hysterectomy, oophorectomy, whatever is indicated. Here we are just going to ask any kind of surgery. Family history, any history of ovarian, breast, colorectal. Here already there was history and you have elicited that. Drug and allergy history, including HRT, tamoxifen use. Social history, smoking, alcohol,
Yes.
and living arrangements relevant for future care, etc. Functional status, daily activity levels, mobility, important for surgical plan. Okay. Coming to the patient safety points. Okay. Red flag symptoms like a postmenopausal ovarian cyst with solid component. And this actually we need to understand from the when the report is given, no, when explaining, you are drawing the diagram, so highlight those particular point, make a arrow, okay, and write down that this particular thing is important in your case while explaining. Elevated CA125 levels in a postmenopausal lady and a high suspicion of for malignancy. Okay, appropriate triage recognizes need for urgent MDT input that you have also mentioned, expedites referral to gynae oncology. Okay, here you have scored properly. Safety netting advises patient on symptoms that require immediate attention like worsening pain, distension, GI or urinary symptoms. And preoperative preparation checks for comorbidities and fitness for surgery, avoids false reassurance while being compassionate. Okay. Then communication with the patient and colleagues explains the result in simple terms. CA125 is a marker that can be raised in ovarian cancer, but also in benign conditions, endometriosis, fibroids, infection, etc. Ultrasound shows a cyst with solid parts. This needs further investigation. Explains differentials clearly. Could be benign, fibroma, dermoid, endometrioma, or malignant. We need to rule out cancer. Okay. Here, when there is a cyst, no, these particular findings we are worried, but we do have certain things which are not cancerous, and that final diagnosis will be after the surgery only. Okay, so you can mention always like that. Even if the investigations are going towards malignancy, that histopathology investigation is required, and whatever will be given, that is going to be final. That you should always mention. Importance for full assessment and including tumor markers, imaging, MDT input. Outlines management plan clearly. Referral to gynae oncology MDT, possible CT or MRI, repeat CA125 of tumor markers, possible surgery for diagnosis and treatment. Addresses concerns empathetically, understands fear of cancer, offers support, reassures about timely investigations and team approach, checks understanding and allows time for questions, communicates with GP MDT colleagues if needed for handover. Okay, so this particular station was quite good. Only thing, one more thing which I wanted to tell you apart from that, yeah, where
Tamoxifen adenotal, HRT adenotes actually. HRT
yeah. um, you offered the support also, because when she was worried, she said no about the cancer and all.
yes. Refer back to GP, I could not tell. Yes.
Yeah, actually, at the time of closing, basically you close the station properly, and then I ask for the other this particular thing. Applied clinical knowledge, this risk of malignancy. Okay, knows further steps. Referral, CT of chest, abdomen, pelvis, tumor markers, surgical options. Okay, knows NICE, BSG, RCOG guidelines, and understands MDT role in diagnosis and plan. Okay, so most of the things we have covered. Let me just go through once again. Was there any scope anywhere further? You also mentioned about the chemotherapy and all, and you also mentioned that at this moment this is not an appropriate unless we come to total that particular thing. Uh, that was the thing which I just wanted to.
Yeah.
All the modalities you have covered, but what is the priority that we should be able to focus? Okay, so let us go to the next task. Just a moment, I put the time. Yeah, your time starts now.
One page or
Yeah,
other?
only one page. Yeah, only one page. Only one page. Time is up.
Okay. Hello, I am Dr. Shanti, one of the doctor in the gynec clinic today. May I confirm your name and age, please?
I'm Susan. My age is 48, doctor.
May I call you Susan?
Yeah, yeah, doctor. You can call me
Yeah.
Susan.
Yeah, Susan, I'm aware that you are referred by your GP and as you have some irregular periods. And also you have a scan done and some tissue was taken as a biopsy. And we are here to discuss that report. Am I right?
Yes, doctor. Actually, last time some test was done, and I was told that the report will be available in some 2 weeks. So I came here, doctor.
Yes, Susan, surely I will discuss your report, but before that, it's that be fine if I will ask you a few questions and I will discuss your reports and then we'll together we'll plan your management. And at the end, I will also write back to your GP and then I will give you patient information report. How that sounds?
Yeah, doctor. Yes, yes, that's fine, doctor.
Yeah. Susan, can you tell me detail regarding your problem?
Doctor, actually, this started maybe an year ago. Initially, my periods become very heavy, and uh, previously I used to bleed for 4 days, but later on 6 days. Now it is almost 8 to 10 days I'm bleeding. Not only that, the periods have started getting quite early also. Every 15 days now I have started getting the bleeding. So I went to GP and I was suggested some test also to meet the consultant. And some scan was also done. So that's the thing, doctor.
Yeah. Do you feel any headache, dizziness, giddy like that?
Yeah, recently in last 2 months, I did notice that I'm getting a lot of exertion. Even doing household work, I'm getting exhausted. Is what I feel.
And have you noticed like a recent change in your weight and appetite?
No, doctor, nothing like that.
And do you feel any swelling in your lower tummy?
No, doctor, no.
Mhm. And what about your water and bowel works?
Uh, I did not notice any specific change, doctor. Fine, doctor.
And regarding sorry to ask you few personal questions. Any problem regarding your sex, any pain or bleeding after the sex?
No, doctor, but this bleeding has made the thing very uncomfortable in the sense, but otherwise, I don't have any pain.
And whether you were using any contraception?
Husband is using, doctor.
Mhm. Mhm. And what about your smear?
My smears were normal, doctor.
Mhm. Any medical conditions? I can see that you're having high blood pressure. Am I correct? Just to confirm.
Yes. Yeah,
Yeah.
yeah, yeah. Yes, yes,
Yeah.
doctor.
So, are you taking any medications?
Yes, doctor. I'm taking tablet for it, and I'm very regular about it. I visit my physician also on time.
And what about any other medical conditions like diabetics and any other problem?
No, doctor, nothing like that.
Mhm. And any surgeries before?
No, 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 no.
Mhm. And have you been pregnant before?
No, doctor, I have got two kids now. The kids have grown up now. I'm not planning any more pregnancies now.
Okay. And regarding your social habits, do you smoke or taking alcohol?
No, no, doctor, no.
Mhm. And are you allergic to any medications?
No, no.
Uh-huh. I can see that your body mass index is 37. Am I correct?
Yes, doctor. It's on higher side, doctor.
And what about your blood group?
It's A positive, doctor.
Reservation for blood transfusion?
No.
Mhm. And how is your support at home?
Yeah, my partner is very good, supportive, doctor.
Mhm. And do you feel low or depressed in last 4 weeks?
No, doctor, nothing like that.
And any family history of, I'm not scaring you, any family history of cancers like breast cancers, ovary, womb cancers in the family?
No, nothing specific, doctor.
Mhm. Okay, thank you so much, Susan, for giving me this information. I will examine in the presence of the saffron just to see the general conditions of yours and also to see the feel of your tummy and to see down below any bleeding or discharge is there or not. Okay, so I can see that you are here alone today And I have to give a lot of information today. Is that fine if I will call you someone to be with you to participate this discussion?
Uh, is there something to be worried in my reports, doctor?
Susan, I have confirmed your name and your NHS number in the tissue analysis report. We call it biopsy report and also your scan report. And I can see that the tissue report I can draw here for you. So this is the womb, and this side is the ovary, and this is the tube. So there is the lining of the womb. Okay. So in your case,
Um,
usually lining of the womb is usually you know it is increased. Lining of the room is thickened. That is in your case it is 14. That's why only they have taken the special tissue biopsy. So that biopsy has come. We call it abnormal cells. So it has become a complex hyperplasia that is called the cells has become the abnormal cells, which is not the normal. Usually simple, it can be simple or it can be atypical. Atypical means that cells has become the abnormal.
uh, Doctor, I am not getting what you are saying. You mean to say, what do you want to say? Is it a cancer or something like that?
No, actually, Susan, it is not a cancer. But if there is a treatment for this, and if you are not getting a treatment and we leave it alone, so it can progress into cancer. Are you with me?
Oh,
It is not a
yes, doctor.
cancer. Yes.
Okay, doctor. Okay, okay, okay.
Yeah. So regarding this, because it is a pre-cancerous conditions like before the cancer, so it is like there is good option cure is available. So if we treat appropriately, your care will be like a team of doctors, my consultant, and also the specialist nurse, and also the tissue analysis doctor, and the cancers doctors, and will be referring you to the specialist clinic, oncology clinic. And the different methods of treatment are it can go for surgery in which we have to remove the womb and both the tube and ovary depending upon your choice, and also depending on other risk factors. Other is we have to remove the only the womb. Okay. Other options would be as you have already completed the family. So this will be the better options for you. Are you with me?
Doctor, but I am really scared about the surgery, doctor. Is there any other treatment where there is no
Yes.
surgery, doctor?
Yes, there are other options as well. So we can give, that hormone coil. We call it Mirena, and other options will be the hormone progesterone tablet can be given. So in that case, we need to do follow up every 3 months. And these 3 months follow up, we have to do the tissue sample from the lining of your womb, and we have to see whether it is persistent or whether it is improving. Sometimes it can improve, and sometimes it will worsen, and sometimes it will be persistent. So if there is persistent, we need to go for surgery. Are you with me?
Yes, doctor. Yes.
Th-
Mm,
Yeah, and one more thing, also you have got your body mass index also towards a little higher side. So this also causes towards the higher risk of increased risk of cancer if we don't go the early treatment. Are you with me?
yes, doctor. But what is the chance that I'll have a cancer? I mean to say, basically, I was looking because my kid's exam is going on. So can I
Yeah.
postpone the surgery, doctor?
Actually, if it is in this condition, like the chances of becoming going into cancer is around 27 out of 100. Okay.
Okay.
Yeah. So every if you don't want, if you're not willing for surgery, you have to go for the Mirena, or you can go for the medications. And every 3 months, you will be doing your tissue sampling. Okay. And if anytime it becomes the normal, if there is two tissue sample becomes normal, then we have to follow you every yearly, 6 to 12 months and yearly.
Okay. So we will have to. I will have to come for follow up again and again for
Yes.
30
So
minutes.
I will also give you appointment with my consultant. I will give you patient information leaflet as well, and I will write back to your GP. And I know this is a very challenging situation to think
Time
of.
is
So I
yeah.
will, yeah.
Okay, good. So this particular station was a very straightforward station. It's a premenopausal lady with endometrial thickness of 48 millimeters, 14 millimeter, and there is a atypical endometrial hyperplasia. Okay, and here with high risk factors, she is obese also, and there is a history of hypertension also.
Yes.
So information gathering is your complete. Here you have not missed anything in the information gathering. So that particular component is, I'll say, it is a pass as information gathering tool. Patient safety points you have covered, especially the BMI, the blood group, and allergy. Those points are definitely asked. You have taken care. Then about the atypical endometrial hyperplasia, the surgical management is the preferred management.
Mm.
Here you could have further mention about the route of the surgery. Okay, that particular thing is because here laparoscopic hysterectomy will have a early mobilization. She had that particular thing, shall I postpone and all. Okay,
Yeah.
so
Mm.
those particular hints you should pick up basically.
Okay.
Okay,
Mm.
uh,
Okay.
uh, you must have realized when you read the guideline, whenever the laparoscopy comes, they say that early mobilization, quick
Yes.
recovery, all the. So that particular point you try to focus here on.
Okay.
Second thing is that the conservative management is not very appropriate because she has got other high risk factors also. So the other management option is available. Definitely, it is a shared decision maker. So you have to talk about that. Okay, but it doesn't seem to be appropriate for your case because you already have a blood pressure. Your height to weight ratio is also on higher side, and it is not suitable for your case. Okay, those patients who opt this, we need to keep them under surveillance. Okay, and 3 monthly and all. But after this, any progression, they will have to undergo surgical treatment. Okay,
Mm.
so that particular thing you need to mention. So otherwise, the task was very straightforward. Okay.
Mm.
Then let's discuss about some points. So simple phrases that can be used in the task. This is not a cancer, but there are changes that could turn into cancer over time if not treated. The safest
Mm.
option for you, since you have completed your family, is to remove the womb through the hysterectomy. And because of your weight and blood pressure, we'll take extra precautions if we go down the surgical route. Okay. So here you can mention about the scope rather than further this particular thing. Okay. Now coming to the information gathering, clarify presenting symptoms, duration, severity of heavy menstrual bleeding, cycle irregularity, postmenstrual spotting. Then menstrual history, cycle length, duration, any clots, flooding, intermenstrual or postcoital bleeding. Obstetric history, parity is confirmed, family is completed. Actually, these particular points you should highlight as you are not interested or your family is complete, and
Yes.
this is going to be a suitable option. Okay, don't say the only option or the best option. This seems to be a suitable option. However, this is also available. Systematic and associated symptoms, fatigue, anemia symptoms, then weight loss, pelvic pain. You have asked about this dizziness and all. Okay, past medical history, hypertension, obesity, any diabetes or PCOS. Family history, any gynecological colorectal malignancies to rule out Lynch syndrome. Okay, medications, antihypertensives, HRT, tamoxifen, anticoagulants, lifestyle, smoking, alcohol, physical activity, psychological assessment, patient anxiety about the diagnosis and outcome. Patient safety recognizes that atypical hyperplasia is precancerous, high risk of progression to concurrent endometrial cancer, understand the importance of timely surgical referral, avoids unnecessary delay to prevent malignant progression, considers comorbidities for surgical planning, obesity, BMI 37 increases the surgical and anesthetic risk. This particular point you could have elaborated
Mm.
a little bit. Okay. Hypertension must be well controlled. Safety netting advises prompt follow-up if bleeding worsens or new symptoms arise. An appropriate referral to gynecology, oncology, or benign gynae surgery for team for hysterectomy. Now, certain points about the communication with the patients and colleagues. Explains diagnosis clearly. You have a condition called atypical endometrial hyperplasia, where the lining of the womb shows abnormal or disordered cells. It's not a cancer, but it has a significant risk up to 40% of progressing to cancer. You have mentioned about, I think, 27% given in top.
27.
It is given in the
Yeah,
top. Yeah, yeah.
yeah, 27. Yeah.
Addresses patients' concerns empathetically, acknowledges anxiety and reassure that early diagnosis allows for effective treatment, explains treatment options like first line is a total hysterectomy, removal of the womb, especially since the family is completed. We will do bilateral salping oophorectomy, may be considered due to age and risk. Then discuss about the risk and benefits of surgery clearly, including impact of obesity and hypertension. Then medical management for those who are unfit or willing for surgery, high dose progesterone or Mirena IUS, but less preferred in atypical hyperplasia. Then encourages shared decision making and checks understanding. And colleague communication, if surgery is planned, liaise with anesthesia physician. Yes, liaising with the anesthesia team and all anesthesia, she is high risk for surgery. So those particular 1 or 2 lines should come. Okay,
Mm.
he'll refer it to the anesthesia for
Yes.
they'll look into
Pictures.
various parameters and now. Okay, then referral to MDT if any suspicion of cancer. So applied clinical knowledge understands the pathology. It is a typical endometrial hyperplasia which has got high chances of cancer associated with unopposed estrogen exposure, obesity, hypertension, diabetes, nulliparity. There is a high risk of associated or future endometrial carcinoma. Knows management as per the guidelines, definitive treatment, total hysterectomy, oophorectomy may be offered due to age and risk profile. Okay. Medical line is not a first line. Role of MDT follow. The same thing is repeated. So that is the third task. Okay. So this covers about the endometrial hyperplasia. So here actually you are likely to have only two things. One is atypical or second one is a typical. Both will
Yes.
have some space for the discussion. Okay. But overall, this structure will be same what we have discussed. Okay. Should we go ahead with the last task? For
Yeah, yeah,
okay.
yeah. Yes. Okay.
Yeah. Yes. Time starts now.
One page or other pages are there? Okay.
Yes, yes. Time is up.
Okay. Yeah, hello, I'm Dr. Shanti, one of the doctor in Gynec clinic today. May I confirm your name and age, please?
Doctor, my name is Hannah and I am 35, doctor.
Okay, may I call you Hannah?
Yeah, yes, doctor.
Yeah. Yeah. Hannah, I can see from your GP note that you had a smear test And also you have got some the tissue, I mean tissue test from down below, and you are here
Yeah.
to discuss and for the further management. Am I right?
Yes, doctor. Actually, I received later that my some report is not good. Some HPV test is positive, and some abnormality they have mentioned. And then GP told me that I need to meet the consultant. I'm really worried, doctor. What is this letter and what's happening? What is this HPV? That is what I want to know, doctor.
Yeah, sure. I can understand that you are anxious and surely address all your concerns. But before that, let me ask you detailed questions, and then I will explain all the findings, and together we'll formulate your management plan. Is that be fine?
Yeah, yeah. Yes, doctor. That is fine.
Yeah. Oh, okay. So, Hannah, can you tell me regarding are you fit and well? Any problem at present?
I'm quite okay. I'm working as a marketing executive, doctor, and this was just a routine test, and but I got scared with the later.
Mhm. Any discharge or bleeding from down below?
No, doctor, no.
Mhm, mhm. And do you feel that your weight is, there is weight is decreasing or appetite is decreasing? Any problem?
No, doctor, no, no,
And any swelling in your tummy?
no.
And how is your periods?
My periods are very regular, doctor.
And is there any bleeding in between the periods?
No, doctor, no.
And when is your last period?
Around 2 weeks before, doctor.
And any contraception you are using?
No, doctor. Actually, currently I don't have a partner. I'm not using any contraceptive.
And that previously, have you had any children before?
Uh, no, doctor, no.
Okay, so any medical conditions for this you are going to a GP?
No, no, no,
And any surgery before?
no, doctor, no.
Mhm. Any family history of any cancers or any significant I should history I should know?
No, sir, no, doctor, no.
Mhm. And regarding social habits, do you smoke?
Occasionally, doctor. Yeah, smoking is there.
What about alcohol?
Uh, yes, on weekends.
And do you know your body mass index?
It's 26, doctor.
And any allergy to any medications?
No, 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 doctor.
And how is your support at home?
Yeah, my partner. Currently, I don't have a partner, but my partner was very much supportive. Currently, I don't have any partner now.
And do you feel low or depressed in last 4 weeks?
No, doctor, no. I'm busy with my
Uh,
work now. Yeah,
Okay. Okay. So thank you so much, Hannah, for giving me this important informations. And I like to examine in the presence of the subject just to see the general condition of yours and to feel the tummy, how the feel of your tummy, and down below any discharge and any bleeding. Okay. And coming to your concerns, I have confirmed your name and NHS number. And do you want to call someone to be with you?
no, doctor. I'm okay. You can go ahead with the reports.
So your GP, they have done the smear test. That any idea regarding the smear test? Why we do for the smear test?
No, actually, I wanted to know about the latest that HPV is positive and all. What does it mean, doctor?
Yeah. Okay, Hannah. So actually, we do this test. This is called the cervical screening to see any abnormalities in the neck of the womb, and so that if any abnormal is detected, so we can treat early. So this is the screening test. So for you, we have got the HPV. This is actually the type of virus. So we got this HPV virus, and usually this will be positive, 8 to 9 out of 10 women will be positive. And so usually our body systems, due to the defense mechanism, this infection will be clear. But sometimes if our body, the defense system is reduced in case of any illness or any smoking or any other risk factors, in that case our the defense mechanism of our body will not be able to fight this virus, And in that time, this virus will persist and it will cause some abnormal changes in the neck of the womb. Are you with me, Hanan?
Yes, doctor. But
Yes.
if it is so common, then do everyone have to do these all tests which GP told me?
Actually, if it is negative, no need to do, and usually will be follow. But if in your case it is positive, so we need to do the further test. So they have done the some cells test from the down below, and I'm sorry to tell that even that cells becomes some borderline changes in the neck of the womb. So for that we need to do the further test, that is specific test. We call it colposcopy test, and this test is done in the special clinic, colposcopy clinic. And this is to see this is like binocular type of machine in which this is a magnifying glass, so that we will be able to see the neck of the womb very clearly, and any abnormality is detected, that time can be treated or can be tissue can be taken. So how this procedure can be done, this is a very safe procedure actually. And you have like similar to how you had the smear test, so similar to you will be putting the on the pouch, and will be putting like small speculum like it is similar to the your what you had gone through your smear test. After that, the specialist colposcopic will be giving you some solution. We call it acetic acid and that Lugol's iodine, so that the abnormal cells will become more clear. And with this binocular machine, we'll be able to see where the abnormal cells are there, and we can take the sample after numbing the neck of your womb from down below. Are you with me?
Yes, doctor. But then do I have to get admitted for this?
No, actually, this is no need to get admitted. This is a daycare procedure in the clinic. You can do hardly 10 to 15 minutes it will take. And some of them women will not feel any discomfort, but some of them will have some discomforts of burning. So don't worry for that. We'll give you some painkiller medicine. And after that, during the procedure, if any abnormalities detected, we'll be taking you some sample. And sometimes and the further management will be depending upon the report of this, which will take around 2 to 3 weeks. And after the report will be doing. Sometimes if there is no abnormalities during the test, so your care will be like you will be seen by a team of doctors, and then the follow up and the treatment will be told to you. And suppose during this colposcopy test, suppose we are not able to see the neck of the womb properly, so in that case, we need to do the loop cut procedures. So before this procedure, we need to numb the neck of your womb, so that this is hot wire loop. So in that case, the abnormal area will be removed with this wire. Huh?
Yeah,
Please.
doctor. You mean to say you'll be cutting the neck of my womb, doctor?
No, no, not the area which is abnormal. The area which is abnormal, we'll be removing that, and then we'll send this tissue to the lab for the further testing to know whether what type of cells this are. Okay, are you with me?
Yes,
Yeah,
doctor.
yeah.
So,
Yeah, so after that, yeah. So then we'll give you so in between after the procedure, you should not live like you should avoid sex, and also avoid this use of tampon at least for 4 weeks, and avoid the swimming for 2 weeks. And and after the result, we'll be telling you further management and further follow up. Any questions so far?
doctor, actually, currently I don't have a partner, but I am looking for partner. And what about my family? If at all I want to go ahead with the family, then this cutting of the
Yes.
cervix, will it
Yeah.
affect?
Yeah, actually, this this treatment will not affect your pregnancy. But however, so when you become pregnant, there is a chances of there is miscarriage or chances of weakening of your womb, neck of your womb, and sometimes the baby can come early. So when you become pregnant, so we will monitor the length of your womb by from 16 to 24 weeks, and anytime the length is become shortened, we have the risk treatment, so we can put stitch, or we
Time
can
is up.
get the
Time is
hormonal
up.
medications. Okay.
Time is up. Time is up.
Yes.
Yeah. This was a good task. You have performed quite well. But certain thing what I noticed that you have given less time for the role player to speak. Okay.
Okay.
Especially when you are explaining. So initial information gathering, definitely you will be asking, role player will be answering. But when it
Hmm.
comes to the explanation of the report and
Hmm.
discussing the management, give some time. You have asked, have you understood? But after a long period. Okay.
Hmm.
So that is one of the things which you should tell. Second thing is that in the beginning only when the role player started, doctor, I got a letter. I got a letter about some test HPV. That means she wants to know about HPV. Okay,
Okay.
so get certain hints in the examination. It will be some different hint. You
Hmm.
will come to know that you have to talk on that. Okay,
Hmm.
so then later on you explain that this is quite common. Then the body takes care of it. If it remains persistent, it may cause some abnormality. And here in her case, it is not only the HPV which is positive, but associated with cellular abnormality which was there. So
Hmm.
smear test was also normal because
Yes.
management would have changed. If only HPV positive would have been there, we would
Yes.
have asked her to repeat. If the
Yes.
smear was not, so you
Yeah.
should explain that why she is here for colposcopy. Okay,
Yes.
uh, correlation of both the test that makes us to investigate you further, and this we are doing on a safer side. Okay,
Yes. Hmm.
so I have that positive attitude while explaining and all. But
Hmm.
your flow was good. I don't have any objection. Then colposcopy also you explained quite well. Uh, Generally, the questions are asked by will it hurt? Should I get admitted, etc., etc. These are the questions which are asked, and what exactly the test is. You need to explain.
Hmm.
Another important thing which I felt you missed, she said about smoking occasional. Then you should quantify because we are dealing with a CA cervix.
Yes.
Probable, I mean to say, HPV we are dealing with.
Yes. Hmm.
So
Hmm.
smoking quantification is important here. If it would have been a previous case, I would have said, okay, okay, either yes or no. But here,
Hmm.
second thing is that she is saying that she doesn't have current partner. But you should
Hmm.
ask about the previous partners. Here it is
Yeah.
important.
Hmm.
You got it.
Okay.
So,
Yes.
because actually in this particular case, the role player would have asked, is it because I had multiple partners? If you would have asked that question, no, just
Yes.
one.
Hmm. Hmm.
Hold
Hmm.
on, please. Just a
Yes.
moment. I am getting some call. Just- So that particular thing I wanted. So these two histories are very, very
Yes.
important. Otherwise, vaginal
Yeah.
discharge and all those things you ask. But multiple partners and this particular thing, smoking, you should go into the detail because these are high risk factors associated, known factors. Okay.
Yes.
Second thing is about the fertility. Finally, the role player given a hint, but you should try to pick up from the history which is given to you. Okay. So these
Hmm.
were only the points from my side, but they were also equally important. So we'll go ahead with the explanation of the slides. Okay. So in coming to the information gathering, clarify understanding of screening result. Ask what patient knows about HPV or cervical screening. Ask if she has had any abnormal smears in the past. Explore menstrual or reproductive history, regularity of periods, any postcoital bleeding, discharge, etc. Smear history, previous normal, abnormal, etc. Contraceptive use and sexual history. Then medical history, immunosuppression, smoking as a risk factors for persistence. Psychological state, explore current anxiety and concerns like fear of cancer, fertility concerns, etc. Then patient safety, appropriate triage recognizes the need for colposcopy due to HRHPV plus abnormal cytology, avoids false reassurance, explains that this doesn't mean that it is a cancer, but investigation is required. Then correct pathway which is followed, borderline nuclear changes plus HRHPV positive, that is why she is referred for colposcopy. Then ensures patient understanding of follow-up importance is she needs to be explained. Then identifies red flag symptoms like postcoital bleeding, investigates further if present. Coming to the communication with the patient and colleagues. Okay, so explains the screening result in a simple language. Your cervical screening shows that the presence of your cervical screening showed the presence of a common virus called high-risk HPV, along with very small, along with some minor changes in the cells. This doesn't mean cancer, but it means we need to look at the cervix more closely to check if further treatment is required. Then explains what HPV is. HPV is a very common virus transmitted through skin-to-skin contact. Most women will get it at some point, and body usually clears it by itself. However, in some cases, it can cause changes in the cells of the cervix. Explains the purpose of colposcopy. Colposcopy is a simple outpatient procedure where we use a microscope to take a closer look at your cervix. It doesn't go inside your body and usually takes about 15 to 20 minutes. It's similar to having a smear test, but with a longer look. Okay. So explains leads. Okay, if we find abnormal cells that need treatment, we may perform a procedure called as leads, where we remove a small area of tissue from your cervix using a thin heated wire. It's quick and usually done under local anesthesia. Addresses common concerns like pain, bleeding, infection risk, future fertility and pregnancy outcomes, need for follow-up smears and HPV testing. Offers reassurance with honesty. This is very common, and most women with these results do not go on to develop cancer, especially when managed early. So these positive things also needs highlighting. Then colleague communication refers to colposcopy appropriately and ensures timely follow-up based on finding. Applied clinical knowledge, HR-HPV plus borderline changes, she needs colposcopy. Then CIN 1, 2, and 3 management options are different. So you may be given finding also sometimes, then the discussion will go on further options. Then indications for leads, CIN 2 or 3 on confirmed biopsy or seen clearly on colposcopy. Understands the risk and benefits of leads, the risk of bleeding, infection, cervical stenosis, slight increased risk of preterm birth that you have explained. Okay, benefit, curative of precancerous lesions, and we should be aware of cervical screening program, fertility preservation, and appropriate use of terminology. So explaining the colposcopy in a simple explanation, colposcopy is a test that lets us take a closer look at your cervix using a spatial microscope. It's similar to smear test, usually takes around 15 minutes. We'll apply a liquid to highlight any abnormal cells. If anything looks unusual, we might take a tiny sample for testing. It's done in the clinic and most women go home on the same day. Okay, generally that is the question which I said, do I need to get admitted or something like that? So whether what kind of procedure it is going to be, a OPD procedure. So that is what is the explanation for this particular. So overall this task was quite good. Means all 4 stations, there were some suggestions for the improvement. Okay, but no major lacking I found. Okay. Leads also we have just discussed. Okay, so that finishes today's stations.